purchasing accounts are not being used correctly, or maybe they were set up differently. We just want to make sure that we're preventing diversion, like you mentioned, which is one of the biggest risks in a 340B audit. But we also have a pharmacy claims group that meets weekly, where we also discuss and review drug bills, billing changes, or any unusual items that we might see throughout the week. Another thing that you're going to want to make sure you have readily available is your Medicare cost report. That's a huge piece for program compliance, and making sure that you have your PSAs available. Complete that 340B University. That would be my first recommendation. You're really not going to be any help to anybody if you don't understand the program. Completing 340B on demand is helpful, but when you attend that university, the sessions and modules are way more advanced. They're way more in depth. You're really going to get a better understanding of the 340B world.
Welcome to 340B Pulse, a NorthArc podcast powered by Purologics. I am Mohammed Atif, your host. I am CTO and founder at Purologics and NorthArc. For nearly 2 decades, we have been building healthcare system infrastructures, data platform, and compliance-heavy environments where precision really matters. Over time, that work naturally led us deeper into operational realities of 340B, especially around claims validation, reporting gaps, manufacturer requirements like ESP and Beacon, and ultimately program defensibility. And that's really why this podcast exists. 340B Pulse is about thoughtful operator level conversations, not a noise nor politics, but real execution discussion, how program actually function day to day. I'm joined today by my host, Salman Asif, who leads a product and infrastructure initiative across 340B workflows.
All right. Thanks, Atif. Excited to be here. We are going to keep this practical so covered entities and stakeholders involved can understand what they need to check monthly, what they need to document, and what they can prove quickly if needed. And this is the difference between being compliant on paper and being defensible in real time.
Thank you, Salman. Yeah, and today we are diving into a topic that really sits at the backbone of 340B ecosystem. It's about audit readiness as a monthly rhythm. So think of this episode as answering a simple but important question. If I want to be audit ready in next 12 months, what should I be doing every single month, right? And what we shall cover in this one, we will be covering like audit readiness really look like in practice, what to review monthly and why, who needs to be involved across different teams, what documentation actually matters, and where things typically start to drift. And to help us unpack this, we are joined today by Carrie Yannarella, a 340B program manager with hands-on experience in healthcare operations and managing complex systems in dynamic environments. Carrie brings a strong mix of operational leadership and process-driven thinking with a clear focus on improving efficiency and driving meaningful outcomes in healthcare programs. Earlier in her career, she worked as an operational manager in an outpatient setting where she developed a passion of improving processes, supporting clinical teams, and helping her clinics run more effectively. She's also currently pursuing her graduate degree in HR management with a specialization in healthcare, adding a unique lens at the intersection of people, processes, and performance. Carrie, welcome to the 340B Pulse. Great to have you here.
Hi, thanks for having me.
So, Carrie, before we dive deep into specific topics, can you share a bit about your journey into 340B and what keeps you focused in this space?
Well, my journey to 340B was kind of thrust upon me. I was pretty happy in my outpatient setting, but there was a need for this position to be filled, and I kind of got name dropped for it. So I, out of respect, agreed to interview for it, and I like a challenge and I enjoy learning. So I agreed to come over to this world that was completely new to me, and I just dove head in.
Awesome, thank you. So I really love that. And so, Carrie, let's start with the basics. When you hear audit readiness, what does it mean in the practice?
To me, audit readiness means running your program every day as if an auditor could walk in at any moment. So it's less about preparing for a specific audit that will come in the future and more about making sure your processes, documentation, data is consistently accurate and defensible. So it comes down to having a proactive mindset rather than a reactive mindset.
Got it. Yeah, I totally agree on that. And Carrie, what does audit ready as a monthly cadence look like on a real calendar? And are you using any tech or manual processes right now?
We have a few different resources that we use. We have a TPA that we use to manage our split billing software, our contract pharmacies, and we hire an outside consultant to help us with our quarterly audits, our annual mock audit. So those are the big resources that we have to help us manage that.
Got it. That makes sense.
And that is clear that the goal is to avoid annual panic by building those small monthly disciplines. And if the cadence is actually real, you're never catching up, you're just running normal operations, as Carrie you mentioned. So we'll try to get specific to list down like what should be on the monthly checklist, right? So my question here is that what do you review monthly to prevent diversions or duplicate discount risks?
So we always check our purchases versus our dispensations monthly. We keep an eye out for anything that might be over purchased or have negative accumulations, just something that doesn't match right. So this helps us verify if any of our purchasing accounts are not being used correctly or maybe they were set up differently. We just want to make sure that we're preventing diversion, like you mentioned, which is one of the biggest risks in a 340B audit. We have an
Right.
analyst here who helps check our Medicaid claims to make sure that they're going out with correct modifiers, which is another really huge part of the program compliance. So those are the big things that we check.
Right. Understood. Like diversion and duplicate discount risk usually are dramatic and they are usually process consistency problems. And the operator test here is that if an operator and a person working in this domain or responsible could control an artifact and bring it out in a few minutes and explain it in one sentence, right? And that should be the day-to-day cadence allow you to do and monthly processes allow you to do. Now let's talk about sampling because a lot of teams do it, but not all of it actually reduce risks. So how do you approach claim sampling and what makes it useful versus redundant work?
So for claim sampling in our organization, we look at our high dollar medication, our high use medications. We look at floors that have inpatient and observation beds. Um, Again, we also look at Medicaid claims and we look at our referral claims too. So we want to make sure that we're validating patient eligibility on those locations. We're making sure that the correct purchasing accounts were used, the correct modifiers were applied to the claims, and that the correct accumulations are occurring.
Okay, understood. And yes, of course, a lot of teams can win with small but consistent systems. And if they are doing targeted sampling, whenever a workflow changes, for example, a new clinic is added, new pharmacy relationship is added, or new pair mapping logic is added. So to make sure that the new modifiers are accordingly attended to in the different claim sampling is becomes simple if that process is being followed consistently. So we'll try to now understand like what we should be monitoring that can allow us to see the drift and see the errors before they can actually happen. So how do you track that, a system or what exactly you track that becomes your early warning system?
We have a diversion detection work group. We meet monthly. We can meet at any real cadence that we want to, but right now it's monthly. And this is a module within our TPA system that helps us review dispensations that don't match the purchasing data. This is really kind of it helps put it right in our face and show us like what might not be matching up right. Maybe we made an edit on a medication or we added a new medication, and this really highlights for us if there's something or some sort of discrepancy there. We also have a pharmacy claims group that meets weekly where we also discuss and review drug bills, billing changes, or any unusual items that we might see throughout the week.
Got it. So it seems like Gary, you guys have really strong TPA tech support, which is doing a lot of automation for you guys to go through this audit process, right?
Yes, we're very lucky that we have a good TPA. We have a good rapport with them. Our contact there or our customer manager is very responsive, so that really does help our program.
Yeah, that sounds great. So, Carrie, let's talk about different stakeholders and their roles. So, according to your thoughts, like what must be owned by a pharmacy versus finance versus billing versus clinics?
Well, pharmacy really owns the medication, they own the drug bills. Um, they own the education piece of making sure that staff out in the organization is utilizing the medications correctly. As far as clinics, they own the documentation piece. They make sure that the patients are being seen within the timelines specified in your policies. They're making sure that they have referrals in place. Um, Documentation really is just the huge thing. The doctor's documenting that they acknowledge this patient is on this medication or they see this specialist. That really helps down the road when you want to verify other information or referrals or patient eligibility. And finance really owns the claims portion of that. They own getting that education out to whether it be myself or other members of pharmacy, my director, if there's a change in payer status or changes coming down the line with Medicaid or Medicare, they really help get that education piece out to us, and they help when it's time for audits. They'll pull those claims for us, which is what an auditor is going to look at. So making sure that we have good communication channels with them is really important. I also think your senior team is a vital part of this as well. Your senior team, your senior leaders should be able to speak to what the 340B program is and what it means for your organization. And if they don't know, then it's very likely that the rest of the organization doesn't know.
Got it. That sounds great. So, where do you think the gaps come around? Like, is it more about the communication between these different stakeholders, or is it more about handoffs or any kind of data gaps, or there is role confusion? Where do they get stuck?
I think it really first comes down to lack of education. I don't think a lot of people know what 340B is or that we are even enrolled in this program. I mean, I'm a perfect example. I didn't know that it was a thing. So it really does come down to education, and then lack of communication is probably the next big thing. Everyone's kind of stuck in their own worlds. Finance isn't really on site. They're at a separate location. And so it's hard to get everyone on the same channel and same thinking if they don't know, what it is, what 340B is, what it means to them, and then what it means to the organization.
Yep, got it. And I
Right.
totally agree on that. Yes, Suman.
Understood. Yes, of course, and that resonates a lot with what we have seen in the 340B space as well. And exactly the problems that you identified here are quite a lot seen usually with covered entities working with larger networks. That most compliance failures are usually the ownership failures. And when the handoff is unclear, the evidence trail is obviously likely to break. And cross-functional clarity is also has to be controlled. If it only lives in one person's head, it's not really resilient. So let's make this concrete and understand what documentation should always be available that you need to pull instantly when needed. So what are the 3 to 5 artifacts you want to be able to pull instantly if asked?
First, you definitely want to be able to pull any policies that you have on the program. You always want to make sure that those policies are up to date and that you guys are always reviewing them. at whatever cadence you guys have in place in your organization and that you're following the procedures you have in place. That's, the first thing that an auditor's going to ask when they come to your organization. You want to make sure that you're keeping a record of any audits that you have completed in the past. And if you have any internal findings, you want to make sure that you've documented those corrective actions that were taken. This will help promote accountability, and it can be a crucial reference for future audits. And it helps everyone understand previous findings, reoccurring concerns, or areas that were improved on in the past. Another thing that you're going to want to make sure you have readily available is your Medicare cost report. That's a huge piece for program compliance, and making sure that you have your PSAs available.
Okay. Okay, great. So with that, like I also wanted to ask, like for making it simple for the other 340B operations team who are new to this, who are new to these roles and are, want something simple enough to follow. So is there like any consistent documentation, templates, checklist, monthly packets, meeting minutes that you keep without overbuilding them, of course?
So we have a planner in Teams or whatever other application you're using, and there we keep track of checklists, what has to be done every time we build a drug or something, and it has everybody that's involved in that attached to the planner, and they all have their own task assigned to them. I'm in the process of actually making updated and completely new procedures for our buyers. I'm putting together education for our work groups, for our steering committee. I'm sharing news that I'm getting from my resources to members of the steering committee, to members of the work groups. I'm just making sure that I'm passing along that information to them. That way they don't have to go out and seek that information themselves. And I do keep all of our meeting minutes. I keep everything that I have sent to them, just as a reference if I need to refer back to it in the future or, for whatever reason.
Right, right. Yeah, that is true, of course. Like the documentation is the program's memory, right? Without it, every question can become a whole new investigation of its own.
Mhm.
And it's always crucial to note that the goal isn't more documents, it's fewer blind spots and faster explanation. That should be the end goal with this kind of documentation and what we should be trying to achieve as a team. So, we would like now to clarify like how we can make this sustainable, like so teams don't burn out. So for that, we wanted to ask you, like, how do you prevent compliance burnouts, especially when the work is constant and the stakes are high?
So for automatizations that we have in place, we have reports that we've set up that automatically run for us. So staff doesn't need to, or our analyst doesn't need to go in and manually pick which audits that they're going to, or claims that they're going to pull for audits. Set up reports with your wholesalers so it automatically comes to those key players, those key stakeholders, and shows them what they should be looking at versus them always having to remember to pull that report or remember to include this or that on the report. Use the resources that you have available is going to be really important for that.
Right, right, great. And just another question, like I had like as a follow-up regarding that, like if there were any habits that helped your program mature the fastest that you would like to share with everybody.
I would definitely suggest anybody that has a direct 340B role to enroll in the 340B University. It really is a huge asset. That was one of the first things that I did when I came over to this position. I told my director that, I have no idea what this is. I'm not going to be any good to anybody unless I complete this and I work on it. And that was the first thing that I ticked off. And it really did help, and it set the path for me to make this a great program for our hospital, and to expand on it and just to make it better. So I would definitely suggest 340B University. They have on demand, which is a smaller sessions. They have webinars. Really make sure that you're getting that education out and letting your staff have the time to attend those trainings and webinars, because 340B is always changing.
Right. Well, that's
Great.
actually good to know for me because that's a checklist check mark that I've completed already. So thanks a lot for mentioning that.
Well, thank you, Carrie. So it seems like you have been right in the middle of 340B operations, managing teams, handling compliances, and dealing with real-world execution challenges. So, according to your experience, what's something people don't talk about enough in 340B space?
I think something that isn't talked about enough is how complex the program really is. It's not enough for just one or two people to try to manage this program for an organization. It really does take a team. It's ever changing. It's always adapting. The rules are constantly going back and forth. There's new things being added. There are just so many different boxes that you need to check and things you need to look at, that making sure that your senior leaders know that you're going to need more support than just you or two people on this team. So I don't think that bit is talked about enough. It's easy for organizations to say no to additional staff or additional roles, but they have to think about what would they not be able to accomplish or provide for their communities if they're not able to remain compliant with 340B and lose that.
Yep, I think that sounds great, and I have seen that, like, with the continuous changes from HRSA side and the rules and everything, we need to have a solid team who stay ahead of the game and keep adopting whatever changes are coming. So Carrie, you have raised like multiple points in this conversation. One is about education, then communication gaps, and then that you need to have a solid team who is staying ahead of the game and updated on everything, and the data visibility. Do you think all the updates in the tech and AI can help any of these areas?
Oh, absolutely. I think it's really important that you have a TPA or a consultant team that is working for you and with you and not against you. Make sure that you're, like I already mentioned, attending all those webinars, attend the trainings. There are modules in our split billing software that I'm sure we haven't even touched yet because we're not aware of it, or we haven't done the training on it. There are definitely a lot of resources out there to make your work easier. There are consulting firms out there that use applications that can audit all of your claims instead of just a certain sample. So it really is just, about finding what's going to work best for your organization, what you guys can reasonably afford and put into practice, but still making sure that you're being compliant and hitting everything that you can. And I I think AI is fantastic. I think it's a great resource.
Yeah.
Um,
Yeah, I
it's
think
definitely helpful.
there needs to be still human in the loop. We can automate a lot of workflows. We can bring a lot of automation, but due to like heavy on the compliances side and nature of this industry that is keep changing, we we need to keep human in the loop, and those humans also needs to be staying up to date with all the latest tools and compliances happening in this industry, the way you explained through webinars and 340B University and other sources. And on top of that, like the way you guys find a great TPA, it's great to have someone solid consulting firm or TPAs who can support you and you stay compliance end to end. So, Carrie, before we wrap up, uh, if you were advising a new 340B program manager, what would you prioritize in first 90 days?
Complete that 340B university. That would be my first recommendation. You're really not going to be any help to anybody if you don't understand the program. Completing 340B on demand is helpful, but when you attend that university, the sessions and modules are way more advanced. They're way more in depth. You're really going to get a better understanding of the 340B world. They have resources that you can save on your computer or, whatever you're using. That really saved me. It really did help me and set me up for success.
Yep, and I totally agree. Education for this program is the base, and you have really pinpoint the center of this, and I think that is going to be a right way to move forward. And Carrie, for those listening who may want to connect with you or learn more about your services or how you can help, so what is the best way to reach out to you?
The best way to reach out to me would be through email. It's basically a second text message for me. Do you want me to share my email?
Yeah.
Okay.
What is your email or website or phone number?
Yep. So my email is cyannarella@shsny.com. That's definitely the best way to get a hold of me. I'm very responsive to the emails. I can be used as a resource, somebody for you to just bounce ideas off of, just somebody to collaborate with or, share your frustrations with about 340B.
Right.
So yeah.
Well, thank you, Carrie. Thank you for joining us. This was really thoughtful and grounded. Exactly the type of conversation 340B Pulse is meant to bring forward. At NorthArc, we focused on helping cover entities strengthen visibility, improve ESP and beacon readiness, reduce operational burden, and enhance audit defensibility without disrupting existing TPAs or workflows. If you'd like to learn more about us, visit northarchealth.com. This has been 340B Pulse, powered by NorthArc. We shall see you next time.